Thank you, Amy, and thank you for your leadership. It is great to be here and to talk about a subject that I love so much, family caregiving. For those of you who may or may not know me, I had 5 generations in my family living, and I was blessed to have my great grandfather come to live with me and my mom, and I also had grandparents living just recent until the last 5 years. So this is an issue that I know impacts so many families and family caregivers. So again, I'm Dana Kennedy, and I'm delighted to be here with you today. And caring for a family member or a close friend is one of the most important roles you'll play. It may start with driving your loved one to get groceries or going to the doctor. As time goes by, you may find yourself taking more and more time off from work, preparing meals, handling bills. No matter where you are in the journey of family caregiving, just beginning to anticipate a need, helping to coordinate a big move, or taking care of a family member full time, having a good framework to help guide you both and your loved ones will make the process easier. So, I want to ask you a few questions to get the picture for today's family caregiver. If any of the following is true for you now or at any time in the past, please raise your hand. Do you currently help a loved one with household tasks such as cleaning, laundry, or yard work? Do you help a loved one with medications? Do you regularly cook or provide food for a loved one? Do you drive to doctor's appointments, make shopping trips, or do other errands? Do you provide personal care such as bathing or dressing? Do you pay bills? So hopefully this gives you a picture of all the different tasks that you do to help your loved ones age in place. As Rosalind Carter, the First Lady, once said, there are 4 kinds of people in this world. 1, those who have been caregivers. 2, those who currently are caregivers. Those who will be caregivers. And those who will need caregivers. So I think we all know how important the role of caregiving is. So AARP has developed this presentation as well as a book called Prepare to Care. When it comes to caring for a loved one, most families don't have a plan until a crisis emerges. So now more than ever, it's important to prepare for the future so you can better meet the demands of caregiving. During this presentation, we're going to give you a framework to help you prepare for providing care for a family member, neighbors, and friends. So are you prepared to care? Let's first take a minute and do a short exercise. Imagine that each task I read is a ball. Take mom to a medical appointment, pick up a prescription, fill a prescription box, call the insurance company, shop for groceries. These are all different roles that family caregivers go through. Um, and I just remember my mom when she was caring for my grandparents, the medications alone were just absolutely overwhelming. And she went to fill prescriptions, and the pharmacist was going over all the different medications that she had to fill and when to give them to my grandfather. And she called me and just was crying. And she was completely overwhelmed with just the medication management of caring for my grandfather. And she was afraid that maybe she would do something wrong and harm him. And so just filling prescriptions is a role in caregiving, and that role itself can be extremely overwhelming. So you want to make sure that you develop a plan. Please avoid discussions about the future simply because they don't want to think about changes in the lives of the people they love the most. Many people wait until a crisis occurs before they talk about their values and preferences, wishes for healthcare details, about their finances. It's never easy to bring up what you think is an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk with your loved one before a crisis occurs. Tips for starting the conversation, and this is actually often very challenging, is when do you start the conversation? So with my great grandfather, he, his second wife actually died unexpectedly, and he had macular degeneration. So although he could do a lot of things for himself, He without being able to see, it created a lot of challenges. So he automatically had to have somebody, come in and help with his finances, drive the car. So he came to live with my mom, and then they ended up setting up durable power of attorney for healthcare. But if all of that had already been discussed and who played what role, it might have made it a little easier for my gramps. So you want to look for an opening. I'm starting to think about estate planning. Do you have any advice? Or I just read an article about gathering all your important papers. Sometimes you can show me where yours are and what you'd like to do just in case. And I know with myself, I just recently started, putting all my things together. So even though I'm 50, it's never too early to start to plan. As far as if something were to happen to you, an accident can happen in any day. These conversations shouldn't be so difficult to have. So you also want to size up the situation. When is the right time? All of the families together, that might seem overwhelming. But you do want to at least start to have the conversation, start to think about what your loved ones want. I know for my little sister, I'm actually she has me making her healthcare decisions in the event that she's not able to, and then she also is able to make the decisions for me in the event that I'm not able to. And we've kind of taken my mom out of the picture, and she actually took her husband out of the picture too. And so I know what she wants and I would be able to execute it, but she thought having that distance might be helpful. So it's always good to think about who do you want to handle your finances or your healthcare decisions in the event that you're not able to. Tips for starting the conversation. You want to think about bank accounts, investments, insurance coverage, and other resources. So money can be a particularly sensitive subject to talk about, often at the heart of many decisions you'll make with your loved ones. And you have to consider how you're going to pay for housing, healthcare, and expenses such as groceries, medications, and potential care needs. And sometimes you can have a professional do this if there's somebody in your family that you don't know that they would take your finances seriously and make the right financial choices. So it just depends on your own situation and what you feel comfortable with. Um, so tips for starting the conversation if there's counter resistance. I just don't want to talk about it. When I first thought about my own decisions regarding healthcare, I, read the book about Karen Ann Quinlan in my 20s. And I always thought, I do not want to put my mom in that position. I want to make those decisions for me. I was working in healthcare. So I thought I was doing the right thing by doing a durable power of attorney for healthcare decisions and giving that to my mom. My mom said, I don't want to talk about it. So sometimes talking about you can actually open the door to have them talk about it as well. So you want to keep in mind that people are private by nature. Sometimes it's hard for someone to admit they need help, and you may encounter some resistance. And if your first conversation doesn't go well, try again. If you're still running into difficulty, try asking a trusted family friend, doctor, or faith leader to share your concerns. I have, a coworker that was actually having some concerns regarding her parents, and I said, you should just notify the doctor. And even though the doctor can't share information with you, if you just notify the doctor when your parent does go to meet with their doctor, the doctor's more likely to start the conversation to make it a little bit easier for you. Um, Step two is critical, forming your team. So caring for a family member or a friend can be a big job for one person. Try to do Trying to do everything yourself may lead to burnout and problems with health and well-being. It's important to reach out and form a larger network of friends, family, and community resources that can help you with your loved one's care. Your loved one can help you identify willing members that you may not have thought about, such as neighbors or friends from the faith community. I know when my mom was caring for my grandmother, she could be quite a pill, and sometimes they could actually butt heads. Surprisingly, that would happen in a family. Um, so I would say come to my house in Thanksgiving, and Grandma can stay with me, and I'll bring her back on Christmas. So that gave my mom an entire month of respite, and really gave my mom a break from the day to day. And my grandmother didn't require a lot of care, but just the personality. So when my grandmother was with my mom and I'd call and talk to my grandmother, she'd be like, I can't believe your mom made that for dinner. And, really picky. So when my grandmother came to stay with me, I thought I was, taking her out to happy hours, taking her shopping. If a friend was having a birthday party, I'd bring her along. My grandmother was often the life of the party. And then when she talked to my mom, Dana leaves me by myself all the time, all day long. So, it's always good to make sure that you have a team that can support you. Sometimes there's somebody, who may be a computer expert that can help you, set up the bills with bill paying. And there's usually something that everybody can do. You just need to ask for help and form that team. So look for team members. They can live by or at a distance, just like I lived a distance from my mom, but it actually allowed me to have my grandmother with me for a longer period of time. You can also think of neighbors. Sometimes neighbor can just come over if you need to do some grocery shopping and you can't leave your loved one by themselves alone. Um, you can help with simple or finite tasks, and you can get their talents and strengths. So, you know, again, a computer whiz in the family can help with electronic calendars, dinner delivery, and chores. So my stepmother, she actually had a very large family, and what they did for caregiving for her parents is each child spent the night one day a week. That way, it wasn't too much for any one person, but they all shared. Determine the number of people you need on your team, and again, assign those roles and responsibilities. Both quantity and quality are important to think about when building your team. While having a large caregiving team can be helpful, it also may be too much to manage. And make sure everyone on the team is clear about their responsibilities and are supportive and willing and to strengthen both you and your loved one. And another example is my stepfather. When his mom was alive, all the sons would call and say, did you take your medication? And what happened is she was actually over medicating because, do you remember if you took your medication this morning? Probably not. I fed my dog and then I started wondering, did I feed my dog? So we all can, sometimes just overlook really simple tasks. And then if somebody starts to question us, we start to question ourselves. So it's really clear. So what we did in that instance is we just assigned one person to be responsible for reminding her to take her medication and medication management, not all of them. But we made sure that we gave each son a role to play as well, so they felt involved and part of their mom's health and well-being as well. Again, step 3, make a plan. So now that you have a team filled with willing caregivers, it's time to start building out a plan and designating responsibilities. Always make sure your plans are being made with the person you're caring for at the center of the discussion. The plan doesn't have to be extensive or fancy. You can never anticipate every detail in the scenario, and the plan should include immediate needs as well as plans for the future. So you just want to think who's going to be responsible for meal preparation, who's going to be responsible for taking, your parents or your loved one to the doctor, who's going to be that person that's communicating with the doctor. And I think that's a role that either you want to make sure you have one person, or you could lead to some problems down the road if too many people are communicating with the doctor. Tips to make a plan. Meet with your caregiving team. First, you want to set up a meeting with your team. This may take place face-to-face or over a conference call or through a series of emails. Determine what works best for your family. Next, determine the needs and goals of your caregiving plan. Remember, this doesn't have to be extensive or fancy, as you can anticipate every detail or scenario. Just try to include immediate needs and a broader plan for the future. Tips for the team meeting. Include the person who will receive the care. I can't share how critical this is. I have a coworker that was actually, they were having a team meeting, and the mom was in the hospital, and the doctor was coming in to talk to them. And so the doctor started talking about the mom's diagnosis. And all the family said, oh, no, 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 we can't do this right now. We need to go outside here. And so they went outside to talk to the doctor, excluding his mom. And I said, do you think that, that was your intention? And they really hadn't even thought about Mom probably has her own thoughts and feelings as well. And so they definitely included her in the future. Um, Step four is to find support. If you've come to realize that or care of needed, the scope of care needed for your loved one is beyond what your team can provide, it's okay to reach out for extra support. There are a number of ways you can get the help you need. So when we talk about caregiving, not all family members are comfortable providing the intimate care when somebody becomes potentially bedbound. So it's okay if you're not comfortable with that to be able to hire a professional or to go to an organization that might be able to provide bathing services. It just depends on you and your comfort level. I know when we've done research in the past, especially the male family caregivers often don't want to bathe their mother, and that's understandable. But remember, this is custodial care, so sometimes families do need to do that. And and so everybody just needs to think these things through. And then if you're able to afford, somebody to come in and do certain tasks, it's fine to ask for help and get that support that you need. And sometimes you're eligible for services that you may not know that you're eligible for. So it's always good to reach out to your area agency on aging. And they can usually send somebody out and kind of provide some uh, additional information regarding resources. Um, Speaking of resources, we want to make sure that you do connect with your local area agencies on aging. They can connect you to a variety of support services, such as home delivered meals, transportation, adult day care services. A lot of people don't even realize there's places where you can actually go for and take your loved one during the day. And sometimes, especially if they have dementia, it's really critical that they have that interaction and that they are able to provide, participate in programs and support. So if there is an adult day center, I certainly encourage you to look at that. There's care management, and sometimes even a doctor can write an order to have a home health care agency go out. And a lot of hospitals, when they do the discharge planning, if your loved one was in a hospital, which is often the case of when you start to think about these things, is because you're in a crisis. So you can also consult a professional. So oftentimes a parent needs can be complex, especially when health and emotional and financial services and arranging and monitoring their care can be the you know a professional can help you with that. So we strongly encourage you to reach out to the elder care locator um, when appropriate. And AARP does have the Prepare to Care booklets, and they're online. So all you have to do, rather than give you a long link to a Prepare to Care guide, all you have to do is go into Google search or whatever your search engine you use and type in Prepare to Care and AARP, and it will take you directly to a PDF of all the information that I've provided you with. We also have some local resource guides on AARP's website. So you can also get a PDF of a local resource guide to help you prepare for caring for a loved one. The types of support that you could get, you can hire help. If you see that your loved one needs help with their daily activities, try exploring your home care service options. Some home care workers do tasks such as housekeeping and meal preparation, while others do more hands-on tasks such as connecting them with the appropriate services. You can also go online and again, go to AARP's Caregiving Resource Center. It's chock full of information. Um, you can also secure their safety. The main goal is to help your loved one stay home and independent as possible in their own home. So try incorporating handrails, grab bars, night lights, adjustable shower seats to make the home safer and more comfortable. You can also check out AARP's Home Fit Guide for a whole range of solutions. And step 5 is take care of yourself. Don't overlook the impact on caregiving on you. Pay attention to your own health and well-being. If you're not healthy, it's going to be really challenging to help keep your loved one healthy as well. So you want to tap into resources such as social workers, nurses, and other professionals who can guide you through care choices and help monitor the care when that you need when you don't live nearby. Again, resources, AARP is chock full of resources. As I've mentioned, AARP's Online Caregiving Resource Center several times today. So I want to make sure I talk about that in a little bit more detail. It's a great place for caregivers to find information on a variety of topics. For example, learning about Medicaid and Medicare. In Arizona, we have what's called the Arizona Long-Term Care System, or called ALTEC. We also have a department on aging, and they can also guide you through what's available. We do have respite services that if you go to the Caregiver, Arizona Caregiver Coalition, there's information on respite services, and they can also help pay for an adult daycare center for you and your loved one. So I want to thank you, but we're not completely done. I think some of you may have questions. I also wanted to talk, as far as I realize that many of you are local governments, AARP is more than happy to do this presentation as a lunch and learn in your workplace. We have people who can come out and do presentations, and we'll provide the prepare to care booklets as well as local resource guides if we have developed those in your area. And we can even help pay for lunch if you think that pizza might attract your employees to come and learn about this. You also want to make sure that you think about what you're doing to help your employees be able to care for their loved ones. Medicare doesn't cover custodial care, so it's really up to the family members to be able to prepare this care. So I often say that, we have over 800,000 family caregivers here in Arizona. They're going to work every day. So sometimes, they're often taking care of their children as well as their family members. It could be their parents or their grandparents or siblings. That caregiving benefit, if you have a caregiving benefit, you want to make sure that you share that with them. At AARP, they actually to provide us with a great service of, we actually have caregiving time off, where we can actually provide a caregiver. If I have several of my staff that actually use the caregiving time, so they could just take 2 hours off to take their loved one to a doctor, or they can take an entire day to provide some help to their loved one. And also just flexible work hours. Sometimes just allowing your employee to work from home allows them to do what they need to do to care for their loved ones. Allow them to do a flexible work schedule if that's appropriate. Sometimes coming in at 7 and then leaving at 3 allows them to go home and prepare dinner and do everything that they need. They'll be a much better employee if you're providing these services that allow them to care for their loved one. These are our family members, and many of you are probably going through this or will go through this or will need this benefit. So it's a great benefit if you're able to provide these benefits to your employees. Did I forget anything? Does anybody have any questions? We have somebody typing a question right now. We often learn from each other. Yes, absolutely. Okay. Again, this is Dana Kennedy. I'm going to hand it over to Amy unless there are some questions. Oh, there is a question. Foundation for Senior Living also has an Empowering Family Caregiver education series that covers these topics, 4 in 1 hour workshops. These are free and presented to your site. Thank you. There are many organizations that do provide caregiving support services, and caregiving support services is absolutely critical. So do absolutely utilize those support services. You learn about how you can, there's some tips that you can learn, especially if your loved one, is not able to get up and be as mobile as they'd like to be. Sometimes we call that, they're bedridden, and there's a lot of things that you can do to help your loved one be comfortable in bed and not break your back. So caregiving support services. I know the Foundation for Senior Living has a caregiving house where they actually, teach family members how to transfer a loved one without hurting themselves. And so there's a lot of resources out there. A lot of people are working very hard to make sure that you can continue to care for your loved ones. So thank you, Amy.
Thank you so much to Dana, and thank you so much to all of you for joining us today. If you have additional resources about caregiving or anything else, please do send those to us. We would be happy to post those on connect60plus.com. We want to make sure that the community has the full array of resources that are at their fingertips, and there are many very, very good ones out there. And this work is particularly important because the longer the older adults can remain in their communities, they can continue giving back to their communities. We all have needs, we all have gifts, and the important thing to really focus on is that we can all share our gifts in a way that works for us. And so for older adults, even if they're receiving care, very often they're also giving care. So they can help with tutoring, they can help with watching the kids, they can help in any number of different services, even if they're receiving services themselves. So I think it's important to recognize that when we care for older adults, we're keeping our community strong because we're keeping our communities intact and that people have the support that they need to continue living in that community. So I think this is really critical. I think it's fantastic that all of you are able to join us. We did hear that some were having some technical issues with some of the audio or some of the video. We will be able to post this webinar online. So if you weren't able to hear all of the material, please do visit the Connect 60 website so that you can listen to the webinar without those technical difficulties. Again, thank you so much. We will be having some additional webinars in the future focused on transportation, as well as learning from age-friendly communities in Ireland. We are thankful for this time that we've had with you today and look forward to our next opportunity to be with you again at a Feed Your Mind webinar series, part of Age Friendly Arizona. Thank you very much and have a wonderful week.